All right. I'd like to call this meeting of the Georgia Access to Medical Cannabis Commission to order at 4:01 p.m. As usual, I want to welcome my fellow commission members and the staff who are with us, as well as the public to this meeting. I'll conduct a roll call of the commission members present to confirm we have a quorum. And I'll start with Danielle Benson, who is our vice chair.
Here.
Bill Prather.
Here.
Jason Shepard.
Here.
John Stewart.
Here.
And Chuck Welch.
Here.
All right. We have a quorum, so we'll move forward with the business at hand. First of all, on the agenda, we need to approve the agenda. And so everybody's seen a copy of the proposed agenda for today's meeting. Do I have a motion to approve the proposed meeting agenda for this June 4th, 2025 commission meeting?
Chairman, I move we approve the agenda.
Thank you, Jason. Do I have a second?
Second.
Thank you, Bill. Any discussion? Hearing none, all in favor of the motion say aye.
Aye.
All opposed say nay. All right, we have an agenda. Since this is a regular meeting of the commission, we will approve minutes from previous commission meetings. Commission members and everyone else have received copies of the meeting minutes from the February 12th, 2025 meeting and for the May 7th, 2025 meeting for review. Does anybody have any changes or amendments they want to make to the minutes? Hearing none. I'll have a motion to approve the meeting minutes from February 12th, 2025 and May 7th, 2025. Do I have a motion?
So moved.
Thank you, Chuck. Do I have a second?
Second.
Thank you, Jason. Any discussion? Hearing none, all in favor of the motion say aye.
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 All opposed say nay. Motion passes. At this point, I'll recognize our Executive Director, Andrew Turnage, for his report.
Thank you, Chairman Johnson, and good afternoon, members and members of the public. Appreciate the opportunity to serve. The Executive Director's report today, I will include announcements, updates, as well as one item for the Commission's consideration and action. First, announcements and reminders for the 2025 application periods. And again, we've announced these previously, so I just want to include these as a reminder since we're having a regular public commission meeting today. The 2025 dispensing license application periods that remain for the year. The first that's coming up on the event horizon is July 28th through August the 1st. And the second is October the 27th through October the 31st. Next is a reminder for dispensing license renewals. And for dispensing licenses that expire on June the 30th, that renewal period will open on June the 9th and close on June 13th. For licenses that expire on September 30th, that period will be from September the 8th through September the 12th. And for licenses that expire on December the 31st, that renewal period will be December the 8th through December the 12th. And last but not least, for production licenses, the renewal periods will be August the 11th through August the 15th for Class 1 production licensees and September 8th through September 12th for Class 2 production licensees. And Mr. Chairman, I'll also share an update. One of the most frequently asked questions that we receive is what's the current number on the Georgia Department of Public Health's patient registry. So I want to include that in the report today just to share that information with members for the commission as well as for the public attending our meeting here virtually. DPH reports the following data as of May the 28th. This is their most recent information that I have. Active providers, there are 759. Active patients, there are 31,887, and active caregivers, there are 2,188. And again, just a quick reminder, the HOPE Act authorizes the Commission to issue an additional dispensing license when the patient registry reaches 25,000. We've obviously crossed that threshold. And then more trigger language in the HOPE Act is the commission is authorized to issue one additional dispensing license to each production licensee for every increase of 10,000 registered patients thereafter. So after 25,000, when the registry reaches 35,000, we'll be authorized to issue an additional dispensing license. So certainly wanted to share that update for members of the public, as well as a reminder for our licensees as the patient registry continues to grow. Also wanted to share, just as a point of information here for members, following the April commission meeting, commission staff, as authorized by the commission members, did renew our independent testing laboratory, SJ Labs and Analytics, LLC. The laboratory was renewed on April the 14th. And then one item for the commission's action and consideration this afternoon is a dispensing license application. And we're certainly pleased to share that we received and accepted one application for Class 2 licensee, TheraTrue Georgia, LLC, for a dispensary location in Atlanta. And if approved, this will be the first licensed dispensary located in the city of Atlanta and the 15th licensed dispensing location in Georgia regulated by the commission. And Mr. Chairman, this application has been reviewed thoroughly by staff and myself, as well as members have had the opportunity to review the application materials individually. This application meets the requirements of the HOPE Act and the commission's rules, and we recommend it for approval and issuance of the dispensing license by the commission. And with that, Mr. Chairman, I'm happy to answer any questions about items on the report, including the application. That'll conclude my report.
All right. Thank you, Andrew. Appreciate your report. Any questions, comments from commission members? All right. Hearing none. I know all of you have had a chance to look over the materials, the application materials, the staff recommendations. So at this point, I'd like to have a motion to accept the recommendations for approval of the dispensing license application as discussed in the executive director's report, and to issue the dispensing license to TheraTrue Georgia, LLC, as applied for and reviewed by the commission. Do I have a motion?
So moved.
Thank you, Bill. Do I have a second?
Second.
Thank you, Chuck. Any discussion on the pending motion? Hearing none. All in favor of the motion say aye.
Aye.
All opposed say nay. Motion passes. Great. Thank you very much. That concludes our business. As a closing statement, just want to once again thank our staff for their diligent efforts and all they do on a day-to-day basis. Commission members, I want to thank you for your ongoing service to the state through your participation on this commission. So thank you for what you do as well. I will pause at this point and give commission members and staff a chance to make any comments they wish to make before asking for a motion to adjourn. Any comments, questions? All right. Hearing none. Andrew, you reported that we're about 31,000 on the certified patients list. The next trigger would be 35,000. Is that correct?
Yes, sir, that's correct. And we were talking about this in staff meeting today, and everyone always wants to know, well, when's that going to happen? And I just happen to have a crystal ball on my desk, so we use that to try to forecast when that's going to happen. And I'll give that a spin. We see the patient registry at the current rate, Mr. Chairman, running along at about 1,000 patients per month. It would be really easy to jump out there and say that's going to be late summer. But if the trend follows the way that the trend has gone in the previous 2 years, it's very possible that during the summer months, especially around the Independence Day holiday, that number may be lower, and so we may reach that threshold a little bit deeper into fall. So it's hard to say, but I would say somewhere between summer and early fall, we would anticipate that trigger number to be reached with the registry as we get 35,000 patients.
All right. Well, thank you for that. And of course, we'll keep an eye on it and react as we need to once we've reached that mark, and not a minute before. All right. If there's no other comments or questions, I'd like to entertain a motion to adjourn this meeting at 4:11 p.m. Do I have a motion?
So moved.
Thank you, Danielle. Do I have a second?
Second.
Thank you to both of you, Chuck and Jason. And any discussion? Hearing none, all in favor of the motion, say aye.
Aye.
And we are adjourned. Thank you very much.
Thank you.
Thank you.
Uh-huh.